Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a dog with everted cartilage of third eyelid, and this is a big breed, a bully dog who has got this problem. You can see the cartilage. It looks like a cherry eye, but it's not cherry eye. We get confused with that. Right now this eye we have put adrenaline, so all the blood vessels are constricted, and that's why you are able to see the white cartilage. Always in eyelid surgery or these kind of surgery, I put adrenaline to reduce my bleeding. Otherwise bleeding, these cases bleeds a lot. And always most of cases you will see the eversion happen at this level, but in this case it is even little bit down also. So I need to remove the cartilage till the little down area, till the here cartilage needs to be removed. In this case, T part of the cartilage I am going to keep little extra, probably till here I am going to cut and then see whether it is staying nicely like this. If it's not staying, then only I am going to cut more. So let's start. I am just putting 2 stay sutures to make sure things stays nicely. The cartilage I can do it a better way, in a better way. So you can visualize it nicely. I am going to give a cut, vertical cut here. I had done surgery for other side, that was, I had done the videography of that side also, but I think in between some video was not working, so I'll just see whether I can put that surgery also together. In that the process was slightly different. In that the cartilage eversion was on the more on this area of the third eyelid. No, I am separating it. I am going to separate this bulbar conjunctiva slowly, either with the blunt dissection or little bit of with the seizure, sharp seizure I can use, or tenotomy seizure also sometimes I can use. Can you give me one fine forceps from eye and one tenotomy seizure? Always try to separate it properly and make sure that we minimize the bleeders also. I separated this cartilage nicely. I am cutting from little down area. where the actual eversion is starting. So you can see the vertical cartilage. I am just separating. One side I already cut. I am just trying to save all the tissue below that, so that only the cartilage should come out, because I go a little down, sometimes from there the third eyelid gland also will come out. So, and normally I remove till here, but in this case I am first removing till this area. I will flatten the third eyelid and see whether it is sitting nicely. If I feel it is still everting little bit, you can see it is still everting little. Eversion is happening despite of removal. So, I am going to go more deeper inside, and I am going to remove more of this third eyelid, this cartilage. Now, I have separated more of this cartilage from here with the anatomy scissor. And you can see that the hardly any bleeding is happening. This, even though I am just dealing with this area of the eye, which is highly vascular area, it is not bleeding too much. You can see the whole cartilage you are able to see in my hand now. I am just trying to go deep inside. Only T portion of this cartilage I am just leaving, the rest I am removing everything. You can see that now it started staying more straighter, and once I do the suturing, it will stay more so suture, because sutures are vertical, they also help to stabilize it. So now we are going to start with the suturing. We are using 50 white krill. For the suturing, I am using same technique what I use for the cherry eye. So just putting the first suture towards the palpebral conjunctiva of the third eyelid, starting from here. I'm going to start from little bit of from the upper area, because I don't want that fold to get aggravated with my suture. So I'm just cutting back this one, and I'm going to keep the sutures a little more higher and then start suturing. From in to out, we'll just start suturing the bulbar conjunctiva. Not tightening these, I'll tighten together because sometimes you tighten the last suture and previous sutures are untightened. You can't untighten the first suture and this tighten all others. So I'm just taking last suture from here. Now this tightening happens very nicely. You're not able to see too much of sutures over this area, and then I'm going to take the sutures from inner side of this area and take it out here, make it tightening here. Putting a knot here. That's it. You can see it's nicely sitting. Okay, so postoperatively we are going to start with the one antibiotic plus steroid for 1 week, and cleaning with saline, probably cold compression for this eye, and one painkiller for 3 days. In some cases, if you see the eversion is still there after you do the surgery, you can suture this eyelid as a third eyelid flap like this flat for 2 weeks, and then once you open this eye will flat, this will be completely flat, this will heal in a flat position only, and it can stay like that. So in case, if any case where we are struggling, we can do that additional part also in this case. Like in this case, the end of this is little everting, but I am not too concerned about this right now because it's going to settle down like this only. But in case if we have more problem, we can do this procedure also. So that's all about third eyelid eversion surgery. Thank you.